What's the best procedure for eye bags?
This question is an indication of the level of confusion in the marketplace where physicians, non-physicians, device manufacturers, pharmaceutical companies, and cosmetics manufacturers are overwhelming the internet, social media, radio, and television with claims of offering the best solution for under-eye bags. As an expert in helping people with under-eye bags since the early 1990s, I'll share with you my experience with people who've come to me after trying a lot of these new and improved ways to treat under-eye bags. I'll discuss my approach to evaluating under-eye bags and the treatment strategies I develop for my patients. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform procedures to help people with their under-eye bags every day in my practice. These procedures include lower eyelid surgery and under-eye filler treatments, as well as lasers, radiofrequency, and PRP procedures, which are used to improve the under-eye skin. I also specialize in revision procedures for treatments done by physicians and non-physicians. These procedures include dissolving under-eye fillers and addressing complications of lower eyelid from eye bag surgery, such as lower eyelid retraction and ectropion. During consultation for under-eye bags, I find that a lot of my patients come in with a list of solutions which they learn after doing lengthy internet research. Another group of patients come in after they've tried several so-called non-invasive procedures which either didn't work or actually made them look even worse. In the course of these discussions, there is a common element to these stories. Typically, they report that they went to someone and that they were recommended to have a procedure with a new device or an injectable as a shotgun approach. These so-called latest breakthroughs are aggressively promoted and, not surprisingly, discounted as an incentive. If something works so well, why should you need an incentive other than a successful result? So what was missing? What was missing was a proper analysis of the anatomy and an unbiased discussion about what are the factors which contribute to them looking tired with under-eye bags. So what I say to my patients is, let's clearly define the problem before we plan the solution. When you have under-eye bags which are constantly present regardless of the amount you sleep, the anatomic issue is most often lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that is under your eyes herniates forward, which we call fat herniation. This problem is generally associated with genetics as well as aging and other variables such as allergies and sinus problems. Staying on anatomy, I also look at the bone structure, in particular the cheekbone structure. I often see prolapse of fat forward occurring at the same time there is a deficiency in cheek projection. When referring to the cheek, I mean the area just below the lower eyelid seen from a front view, as well as the cheekbone, which is the high point on the side next to the eye. It's not unusual for me to see a patient who feels that they have under-eye hollowing as their primary issue in the presence of under-eye bags. This makes sense when you understand that the relationship of the cheek projection to their fat prolapse. This perception of hollow is also caused by the contrast between the height of the under-eye bag, which is like a hill, next to the hollow, which is a valley, resulting in the perception of a hollow appearance. The higher the hill, the deeper the valley or hollow. In addition, I look at the skin quality in terms of wrinkles, tone, and discolorations. It's important to understand that the eyelid skin is the thinnest skin in the body at about 1/2 millimeter in thickness. The recommendations I make to my patients is based on my experience as a cosmetic eyelid surgery specialist with experience in multiple surgical and non-surgical approaches. I also own several lasers and radiofrequency devices, and I personally perform injectable treatments such as hyaluronic acid fillers and neurotoxins. The point is that I don't have a bias based on any limitation in education or training. I select with my patients the approach which I feel is in their best interest to achieve an outcome that they will likely to be satisfied with. I don't lease any devices, and I have no other pressures which would make the recommendations I make. If I think a device or technology is effective, I buy it outright, and I use it when it's appropriate. That being said, let's look at what defines an effective solution for under-eye bags or any cosmetic procedure. In my opinion, the procedure should be one that I would do for myself or a member of my family. This means it should be safe, predictable, and have minimal downtime. Safe is defined by minimal risk of complication from the procedure itself and anything that could be a risk to your health. Predictable means that as your doctor, I can confidently anticipate a level of improvement which can be shown to you in before and after photos. Minimal downtime means being able to go back to your normal life quickly without a protracted recovery period where you look at yourself for weeks and months after the procedure and wonder when you'll finally look the way you want. So here's what goes on in my mind when I see a patient who comes in with puffy eyes. Is their puffiness slight enough with the bone structure anatomy which would allow me to effectively camouflage their puffiness with under-eye filler? Much is promoted about the use of hyaluronic acid fillers as a non-surgical solution for under-eye bags. There are certain anatomical limitations to this approach. The term tear trough is now something anyone doing internet research becomes familiar with. This trough has two boundaries. The boundary closer to the eye is the prolapse fat. The other boundary is a bone structure called the anterior lacrimal crest, which is part of a larger bone called the maxilla. This bone defines how much you can fill the tear trough before you exceed the capacity of the trough from the front. The height or projection of the prolapse fat defines the limit of the filler's ability to diminish the relative prominence of the fat pocket. When the fat pocket and the anterior lacrimal crest are at about the same height and there is a deep tear trough, I can place a filler, such as Restylane, with a blunt cannula and get a very nice result. I often see people who had filler placed to camouflage their eye bags, which resulted in their eye bags actually looking worse. I see this occur a lot when people insist that a doctor use fillers when the fat pockets are much too prominent with no space for filler placement. These are the same people who believe that they know enough to instruct the practitioner on how they should place the fillers. They end up looking worse, and then they blame the practitioner for their outcome when they really needed surgery and refuse to accept the reality that that's the case. I also see people who had too much filler placed not only in the tear trough but also in the cheek from the front and sides, resulting in a disfiguring and unnaturally swollen appearance. This filler, after being placed in the skin much too excessively, causes swelling and probably affects the lymphatic drainage system, which further aggravates the swelling. In these patients, I have to use large amounts of hyaluronidase to dissolve the hyaluronic acid filler before doing anything else. I often see patients who did fillers for a few years to camouflage their under-eye bags and found that the fillers weren't working so well as the fat prolapse became worse and as facial volume loss from weight loss and aging progressed. The next question after establishing that the eye bags are caused by lower eyelid fat prolapse is, to what extent the individual fat compartments are significantly herniating forward. In the lower eyelid, there are three compartments which also have deeper extensions and subcompartments. The compartments are the medial, central, and lateral fat pockets. I have the patient look up in several directions which make these fat pockets become more prominent. I also look at the supporting structure of the lower eyelid, particularly the tendon that is attached to the bone structure called the lateral canthal tendon. When the fat pockets are so prominent that filler cannot effectively be used for blending, a surgical option is appropriate. Surgery is often portrayed, particularly by non-surgeons, as something to be avoided at all costs. I emphasize the word costs since these practitioners cost their patients thousands upon thousands of dollars in useless treatments. It's understandable that there are plenty of examples of so-called botched plastic surgery in the media which contribute to this fear of surgery. I point out to my patients that the people who look natural after eyelid surgery simply don't draw attention, so the fearful patient doesn't get to appreciate good cosmetic surgery results. After so many years in practice, a lot of my patients come because they know someone I operated on and they like the way the person I operated on looks. Resistance to surgery is also driven by the fears related to anesthesia and anesthesia-related complications. In my practice, I perform eyelid surgery under local anesthesia with light IV sedation, as opposed to general anesthesia where you're paralyzed and placed on a respirator to keep you alive. My patients recover quickly and walk out comfortable and happily thanking my staff before they go home. As far as the type of surgery is concerned, my preferred approach to under-eye bags is called transconjunctival blepharoplasty. This is an approach where I address the fat pockets from the inside of the eyelids. In my hands, my patients are able to maintain the natural shape of their eyes, which allows for retaining the character of their eyes. My objective when performing this type of eyelid surgery is to create the appearance that you would have had if you never had prolapsing fat pockets. My patients recover quickly and go back to work in a week, often without any bruising. As a side note, I've seen patients who reported having fillers done elsewhere and having been bruised for weeks, while my patients have minimal to no bruising 1 week after surgery. The next part is skin evaluation. If you have lighter skin with wrinkles and discolorations, I often recommend fractional CO2 or erbium laser to improve the skin quality and texture. I also use PRP or platelet-rich plasma, which is a concentration of the healing factors from your blood which stimulate collagen and blood supply, resulting in better skin. I use PRP for all skin types and have found benefit for darker skin types who are not candidates for laser. As mentioned earlier, the presence of fat prolapse resulting in under-eye bags is often accompanied with a deficiency in cheek volume and projection associated with genetics and aging. Bone structure determines the facial appearance more significantly than anything else. This means that addressing bone volume can help you improve your appearance more effectively than any thermal energy device or the latest innovations with threads. The concept is called structural volumizing, where I use my experience performing facial implant surgery, such as the placement of cheek and chin implants, to place long-lasting hyaluronic acid fillers. I often enhance the cheeks at the same time I perform surgery for under-eye bags. The cheeks can be thought of as framing the eyes, and the balance of the cheeks with the eyes makes the whole face look better. I perform this placement without bruising and without any effect on the recovery time after surgery. I hope you found this information helpful. Thank you for your question.